And welcome back to JKLive here in the studios. We are virtually live today. Dr. Mercy Mwangangi, Chief Administrative Secretary, Ministry of Health. Dr. Kim Shongwe, the founder, CEO, Health Cover, PTY Limited. Dr. Sally Korea, all the way in Ibiza, Spain, talking to you about lockdown, about vaccines, about the way forward. Dr. Mercy, let me ask you this real quick. So 162,000 Kenyans so far have been vaccinated. One of two. So within a span of 6 to 8 weeks, they're supposed to get another shot. And now we're hearing that there could be a delay in the delivery of the next batch of vaccines. Is that true?
Right. So yes, we have received reports from the COVAX facility, telling us that there could be a delay due to global disruptions. I think we've all seen what is happening in India and across the world when it comes to producing enough vaccines, that we can consume. However, a statement of comfort. You will be able to get your second dose in time if you've already received your, first dose. What we're looking at is to then explore mechanisms of how do we ensure that those doses get to Kenya on time. Can we look at other perhaps sources of these vaccines, particularly the African Union, who have recently secured, a set number of doses, or can we have bilateral engagements with the manufacturers? And so there are multiple discussions going on right now with the leadership team in the Ministry of Health to ensure that at the end of the day, if you received your first dose, you'll definitely get your second dose. What we may have to contend with, and really this is, I'm preempting the situation here, but it may be that you may not get your dose at week 8, but you may get it within the 8th and 12th week, time period, which is what is recommended, particularly if you are taking the AstraZeneca vaccine. So at the end of the day, if you got your dose, you will get your second dose on time. It just may not be the time that we, informed you through your message, just because of what is happening globally when it comes to the shortage of this vaccine.
And just to be clear, the expiration date of the present one, if one got a shot already, is what? 12 weeks? Is that
So the vaccines that we got, should be able to stay with us up until the end of June in terms of viability of the dose. If you received your vaccine on the 1st of May, then 8 weeks later, you're expected to present yourself to the health facility to get your second dose. And that's sort of the metrics that Kenya picks. However, from the manufacturer, from AstraZeneca, they give us a period of, a range of 8 to 12 weeks from the first dose. So because of this disruption, it may be that, particularly when we start expecting Kenyans to come for their second dose, which should start at around the 10th of May, if we've exhausted the doses available, and depending on the consignments that will be coming in, we may extend this to within the 8 to 12 week window.
And if another vaccine becomes available at that time, a lot of people are asking, can one mix and match?
No, Jeff. And tonight, I really wanted to, demystify a few of those myths and perhaps even take people through an FAQ, session. If you took the AstraZeneca vaccine, your second dose should still be the AstraZeneca vaccine. And there's a reason for that, because the manufacturers were able to, compute the 2 doses and therefore give you that 100%, protection with the 2 doses. So you have to stick to one vaccine, the one that you took. We are pursuing Johnson & Johnson, which is a single-dose vaccine, and hopefully once these discussions are finalized, we may be able to have the J&J vaccine in Kenya, and that's just a single dose. It's one shot. But up until perhaps yesterday, the doses that we have in the country, that's AstraZeneca and the Sputnik V, require you to have those 2 doses.
All right, let me just cross over when you mentioned, you mentioned J&J. Okay, I'll get you. I'll be with you in a moment. Dr. Kim Shongwe, Dr. Mercy just mentioned Johnson & Johnson. You have that available there, and it's a single dose. Is that making any effect? Is that any different from the double dose?
Well, I think one of the biggest challenges that countries are going to face and will face with regards to rolling out a vaccination program is accessibility and to people. If you give dose number 1, are you sure that you'll get people coming back for dose number 2 to actually ensure that the vaccine itself is ultimately effective? So for a single dose, in my view, has those advantages, or that advantage. A different question could also be, Jeff, people have asked me, should I actually vaccinate? And my answer has been, you must decide, and they ask, is Oxford AZ the best vaccine? Is J&J the best vaccine? And I say to them, I can't answer that question. You must decide. And you must understand why it is that you're going, why are you going to vaccinate? And what I can do is give them the advantages and disadvantages of the philosophy around vaccines and why you vaccinate. We talk about herd immunity. I think people don't fully understand that concept. Side effects are going to be there anyway. Panado has got side effects, which is one of the Panadol. Yeah. So I don't know.
Let me make it more personal. Which one are you going to take when the time comes?
J&J.
Why?
Because it's what we have as a part of our rollout program. It's a single dose, and I believe that it's, from what I'm seeing, other than, side effects, I can't be, maybe I'll be a bit subjective around my reasons for doing it, but it's a single dose, and that's what we have.
So is your message?
And I'd like to go out and tell colleagues, people, the country that listen, I got this, I got this vaccination. The question is then going to be, how long am I safe from COVID for after getting the vaccination? And this is some of the questions that people are asking. You get vaccinated today. Are you safe for the rest of your life? Are you protected for the rest of your, So there are a number of questions that I think still need to be asked around vaccine.
Actually, a lot of people, Dr. Kim, have been asking, once I'm vaccinated, why do I need to wear a mask? Why do I need to show social distance?
Well, I think the more important thing is that when you get vaccinated, you are protected to an extent, but you're still infectious. In other words, you can still carry the COVID virus and pass it on to other people. So yes, you must wear a mask. Yes, you must social distance. Yes, you must wash your hands and follow all the protocols that are in place. You can argue that you're protected for a certain period of time, but you are infectious. So yes, you must follow all the protocols.
Absolutely. Dr. Sally Kuria, let me cross over to you. And, you guys, for lack of a better phrase, are spoiled for choice. Pfizer, Astra, you name it, you have all those choices. Do people come up to you and say, which one should I take? Or do you tell them, take whatever's available?
Well, to answer that question, I always say take whatever's available. The vaccine that works is the vaccine that gets injected into your arm. And there's this phenomenon of cherry picking. So the people who have a chance to choose will say, I want this and I want the other. But in reality, all the vaccines that have been created have been shown to reduce death, hospitalization, and severe COVID by 100%. That means that all the vaccines are effective for vaccination if we want to avoid death, hospitalization, and severe COVID. So in reality, there's no real vaccine that would be, it's very, you can speak a lot about which is better and which is different, which is more or less effective. But in reality, if you look at the times that the studies were done, the AstraZeneca study was done later. It started after August, when the UK variant had already come up. So what we're having now in Kenya is parts of the UK, the UK variant, which is more transmissible, more virulent, causes higher mortality, and we have a part of the variants we have in Kenya now the AstraZeneca has been tested on those variants. The other vaccines, the ones that we have a choice to choose on, were tested only in the US. So this is something that is important to evaluate. The AstraZeneca vaccine has been shown to be extremely effective. And we actually don't have that choice because we only ordered a certain amount of the US vaccine. Italy and Spain, especially, we had banked on the AstraZeneca. And we're soon going to solve the problem of storing because our vaccine rollout is much slower. And I'm very impressed in Kenya that we've moved so much. I know more people in Kenya who've received the vaccine right now than people I know in Spain. If we don't mention the healthcare workers, I know. So it's so important to not say which is better, which is worse, because the most important thing for us to do is to get our vaccine. The best vaccine is the one that your government has evaluated, that is valid for you. And if you actually look into the analysis, the AstraZeneca vaccine is the one that's reducing the death rates in the UK. England right now is totally on a different, they've vaccinated 30 million people. Their death rates are down to 55, whereas Italy is struggling with 44 and is on full lockdown. So it must be made clear that there's no better or worse vaccine in reality, because why we want to get vaccinated is to not die from COVID and not be on a ventilator or have severe disease. So it's so important, and hopping on to what we said about variants. The variants did get worse, as my colleague was saying, because of COVID fatigue, but we are seeing these changes in the virus, and that it makes them more transmissible and more aggressive. So it is important to use the vaccine that is actually useful in the country where they have found that kind of variant.
Yeah.
So I totally believe that AstraZeneca is the right vaccine. AstraZeneca will start being more available because both Spain and Italy will start producing AstraZeneca. Our rollouts here are very, very slow. Only 5% of the population has received 2 doses, and only 9% have received only one dose. We're using AstraZeneca. Our teachers, our policemen, everyone's been given AstraZeneca. There's not that much of the other vaccines. So this is what we're using, and this is what we're banking on. The AstraZeneca vaccine is effective, and if you look at the UK right now, they're in a whole different, they're in a different place compared to the rest of Europe.
All right, Dr. Sally, Dr. Kim, Dr. Mwangangi, let's go to some other experts that we have here. The tweets are coming in thick and fast, and the questions as well. Evans Arwiga is asking Dr. Mercy, this one's for you, I think, yeah. Which vaccines should we go for? Is it the AstraZeneca or Sputnik, since we are seeing the two being administered? And which of the vaccines is available in the country? Could you clarify that about Sputnik now while you're here?
Yep. So, Jeff, in Kenya right now, we do have 2 vaccines available. We have the Sputnik V vaccine and we have the AstraZeneca vaccine. The AstraZeneca vaccine is primarily available in public health facilities and participating private health facilities. The Sputnik vaccine is available. We are yet to release and to publish the list of facilities where you can, access Sputnik V. And I think that list will be out perhaps before the end of this week. We'll be able to go assess those facilities and determine them to be capable of offering Sputnik V. Now, just to add on to what Dr. Kuria said, it's so absolutely crucial for us to understand that the best vaccine is a vaccine that is near you, the vaccine that you can access and access immediately. That's the best vaccine. And, we've received lots and lots of questions of, should I take Sputnik? Should I take Astra? Is Pfizer better? When are you bringing in Pfizer? When is J&J coming in? And I think technically it's important for us to explain to you that that answer cannot be given by any expert right now, because no trial, no study, no scientific study has actually compared Sputnik to Pfizer to Moderna. So no study has been done comparing, should I say, the protective probability of these vaccines together. So there's no such study design in the whole world. So there's no scientist who is worth their merits who can stand forward and tell you that Sputnik is better than Astra. And one important thing that Dr. Kuria has said is that the one evaluation that we have is that all the vaccines that have been accredited, particularly those top 5 vaccines, all prevent death. It means that right now, between you and an ICU bed is that jab. That is what is standing between you and that ICU bed. It means right now, the probability of you ending up with severe disease is determined by you making time to go to a health facility to get a vaccine. That is how serious this is. That all the vaccines available are actually able to give you 100% protection from progressing towards severe disease. And so really the choices of should I do Sputnik, should I do Astra, and we've seen people celebrating and sharing on social media that I got Sputnik and perhaps even giving a false impression that is superior. I can tell you as an expert and particularly a technical expert that is false. There is no such evidence the world over that any vaccine is more superior than any other. And particularly when we look at the one matrix of preventing severe disease, they're all equal. And so the best vaccine is the one that is near you that you can access.
Yeah, maybe some people take pleasure in paying for the vaccine rather than getting it for free.
Perhaps, and nothing, how do I say, it's all voluntary for you to, make a decision of what you want to take. But at the end of the day, I think, particularly because we're in a pandemic, we sort of have to question some of the examples that we set forth for the public, misinterpreting perceptions that perhaps one is superior than the other. I can tell you that all those, are false perceptions. None of that is true, and that's what we have, particularly from the evidence and data that we have. Nobody can say one is superior compared to another.
Yeah. Okay, Dr. Kim, let me go.
Jeff, can I?
Go on, Dr. Sally, go on.
Jeff, I wanted to hop in and say something that's really important about comparing the different vaccines. There is no way that they can ever be compared because they were done on different populations at different times of the pandemic in every part of the world they were done. So the American vaccines were done on a purely American population, and that was the first variant of COVID. So their study started sometime in July or beginning of August, whereas the studies done with the AstraZeneca and the Janssen started later, and they used different populations of the world. So they had volunteers in Brazil, volunteers in the UK, volunteers in South Africa, and at the same time, that variant was the one that seemed to be coming up at the time, if you look at the timing. So what if we were to take the AstraZeneca, the Pfizer vaccine and the Moderna, and apply them to those same volunteers in the areas that the AstraZeneca did? We might not find the same data, simply because we're talking about different people, different races, and different variants of the virus. So there's no way ever we will ever be able to say which is better or worse, because perhaps if we take the American vaccines and apply them at the same time where the pandemics were, because in Brazil there was a pandemic, but they didn't have any volunteers in the American in the Pfizer and the Moderna. They didn't have any volunteers from Brazil. So we might not find the same level as we find now with the AstraZeneca. There's no way we can compare vaccines ever. It's totally impossible.
Yeah. Okay, Dr. Kim, this question could apply in South Africa as it can anywhere else. One is asking, the vaccine is being given priority to folks who are 58 years old and older. That's here. I don't know about there. You could clarify. Also, what happens to people who are younger? And for instance, McKebbs, who's tweeting now, says, I am diabetic. Am I at greater risk? Dr. Kim.
Yeah, okay. Yeah, thanks, Jeff. Excuse me. Just allow me to touch on something that I think people tend to lose track of. The vaccine is not a COVID magic wand to sort all of COVID issues out. COVID has got a lot of issues that need to be dealt with at various levels. There are issues around the fact that we know that, for example, funding for other programs that are killing millions of people on the continent, malaria, HIV, AIDS, TB, and so forth, is now being redirected to COVID projects. We know that gender-based violence and other issues are on the increase as a result of COVID. So, COVID is much bigger than and won't be necessarily resolved by a vaccine. But certainly a vaccine is an important part of containing COVID, the pandemic, and helping us understand how we can develop or contain it in the sense of, as I mentioned earlier. Sorry, your question?
Your question is about age, 58 and older here. If someone is younger, obviously with comorbidities, like that viewer has diabetes, obviously the risks get higher, right?
Yeah. Well, what we've done in South Africa is we've actually phased the rollout of the vaccination program. And again, we talk about frontline health professionals as being, first in the queue, and then we've actually listed them. People who have got comorbidities and the elderly are very high up on the vaccination program. One of the things that I've asked is, we talk about containing COVID in, for want of a better word, slum areas. Like, I'm just thinking a place like Kibera. How do you do social distancing and wearing of masks and washing your hands and sanitization in an area that is so densely populated? Should communities like those not be high up on our vaccination program, for example? We talk about places like in South Africa, Soweto, and Alexandra, and a couple of other places, Khayelitsha, and so forth. Maybe those should be high up in the agenda. But yes, people with comorbidities, people who are elderly, be diabetic, for example, hypertensives, and other, chronic conditions are definitely put as a priority for the rollout program.
Yeah, Dr. Mercy, let me ask you the same question. Here in Kenya, a lot of people are asking, if you're under 58, they don't quite consider you. And people with comorbidities or with underlying conditions, what about them?
Right. So, Jeff, when we started rolling out of our vaccine plan, we had a plan to do it in 3 phases. To start with our frontline healthcare workers, to then move to those who are over 58 and have comorbid conditions, and include within that phase those who may be 18 years of age and above with comorbid conditions. But you may remember that we ended up fast-tracking and sort of merging phase 1 and phase 2. And, as you all know, we have overwhelming crowds in our health facilities, people trying to get this vaccine. What we have planned to do is that, particularly once we get the second consignment, we'll open this up and allow those who may be above the years of 18 and over with a comorbid condition to access the vaccine. Right now, if we opened up and said you can walk in if you're 18 years and above and have a comorbid condition, we would not be able to meet the demand. We are already trying to, ensure that everyone who is above 58 gets the vaccine. And so really what we're saying, particularly when we look at the risk profile, yes, you may be 23 and a diabetic, but when we compare you, a 23-year-old and a diabetic, with a 58-year-old who is a diabetic, he has a higher risk profile than you. And I hear you, we hear the concerns. We've received lots of petitions from young people who do want to be fast-tracked. And we are working hard to ensure once those supplies get to us, we'll include you in that phase.
Okay, good point. Very good point. Dr. Mercy, Dr. Sally, Dr. Kim, I'm going to take another quick break. And here's a question to consider. A lot of questions coming in thick and fast. But here's a simple one. A lot of people are asking, if one has just tested recently positive for COVID-19, should one get vaccinated right away? Think about it. We'll get to you after this break. Keep tweeting at Koinange Jeff, at Citizen TV Kenya, the hashtag JKLive. JKLive takes a break. I'll be back in a moment. Welcome back to Jeff Kenanga Live here at Citizen Television. Dr. Mercy, Dr. Kim, Dr. Sally, Doctor, and your questions coming in thick and fast. I asked this question before the break. Dr. Sally, maybe you can answer this. If one recently tested positive for COVID-19 and then maybe they get an opportunity to get vaccinated, should they, shouldn't they? Is it possible? Is it not? Tell us.
Well, I can tell you what I know for sure, that if you do have COVID symptomatic COVID, you probably need to kick the can down the road a bit and give it some time before you get the vaccine. So you tend to say a couple of, maybe 1 or 2 months would be prudent to wait before you actually get the vaccine.
Yeah, okay. Dr. Kim, do you agree?
I'm not an expert in vaccines, but I would suggest that the sooner you get the vaccine, the better.
Dr. Mercy, what is your answer to this question?
So, I mean, that's a good question, Jeff. Getting a lot of that question from Kenyans. And so this is what the science from the manufacturers says, that they do advocate for you to take the COVID vaccine 1 month after you've recovered from COVID, COVID symptoms, COVID disease. So the idea is that, it may sound a little bit gray, but what we're saying is you are able to access the vaccine 1 month later, contingent on a clinician review. And so you would need a doctor to give you the green light to go ahead and get the vaccine. So you don't just rock up to a vaccination center. It would be prudent for you to have some clearance from your clinician. And when we talk to our immunologists, and particularly, and I want to thank Professor Gontier because he's the one who's giving me guidance in this. He's one of the revered immunologists within the country. He says that you want to safeguard against having an advanced immunological reaction if you introduce the vaccine into a patient who is currently actively having disease, that there is a potential of you elevating and getting sort of a larger immunological reaction than required. And so the evidence and the scientists seem to guide us and tell us that a month after is prudent for you to then come in for your vaccine, but all contingent on a clinician review and approval.
Okay, Dr. Mercy, let me stay with you on this next question. The person's name is actually Flat Screen. Can't make it up. Okay, Flat Screen is asking, Kenya has a population of about 50 million people. Today, very many people are being turned away from various facilities, which confirmed having run out of their stock after only vaccinating plus minus 167,000 people. Question is, what plan does the Ministry of Health have in ensuring supplies are enough?
So thank you, Flat Screen. We did address this today. It came up today in our daily presses that yes, there was a transient temporary shortage yesterday, but that was really occasioned not by a shortage of vaccines because we have them in our stores, but a rollout of a redistribution plan, particularly because we expanded the phases of vaccination. We introduced those over 58 years old. And so what happened is that we were using our old distribution list. And yesterday, a correction was required, which we did. And I think I'm happy, particularly because I've seen it in the news today at 7 o'clock, 9 o'clock, that centers are back vaccinating, and those who haven't received their vaccines should be getting their vaccines within the next 1 to 2 days. So we have vaccines and they're available. Kenyans should be assured that we have not run out of vaccines yet. And we continue to encourage them to present themselves to the vaccination posts for the service.
All right, let's hope Flat Screen is happy with that answer. Dr. Kim, let me ask you this question. It's sort of the one I asked you earlier on, but a little differently phrased. Okay, so one gets exposed to COVID-19, okay? One recovers, right? And then there's a period. One has recovered, there's a period. A question is, does one need a vaccination after that from an immunology perspective? This is Edward Aluda.
Okay. Well, Jeff, there's 2 levels of immunity. I guess the question is, are you immune from a second attack of COVID? So there's what we call passive immunity, which you get once you've actually got the actual COVID itself. And then when you get injected by, for example, a vaccine, maybe taking your question to a different level, which of the two is more effective? Is it more effective to have the actual virus itself and develop immunity through being infected by the virus? Or is it more effective to develop immunity through being given a vaccination? What I've heard is that when people that I've seen, because I've seen people getting COVID twice, the window period is anywhere between 6 to 10 weeks. And I'd like to hear the experience of my colleagues here. This is people who've got COVID, without vaccine.
Yeah.
From what I'm hearing, though, is that the vaccine provides a level of immunity up to about 6 months. But nobody, I think, at this point in time, can guarantee anything longer than that. But I'd like to hear what my colleagues say.
Yeah, Dr. Sally, what do you say? Go on.
So just not to stay too far away from the question, just repeat the question, because I did move on to...
Okay.
Just repeat the question as was asked from the viewer.
Yes, the question was, for instance, let's say myself, I got COVID last year, July, right?
Yeah.
And then I passed through it and I recovered and all that stuff. So, 9 months, 10 months later, do I have to take the vaccine because I've had COVID already?
Yeah, so when you get your first COVID, when you get your the first disease, let's call it, you do passively get antibodies, and then there are 2 ways your body builds up the immune system. So once you have recovered fully, what we did find, as in how much time you are immune, it went up to about probably 3-4 months. And the reinfections, at least in Spain, were not as frequent as they weren't very often. We did have a woman who got reinfected and did have a worse version of the disease, but reinfections weren't that common. But you should get the vaccine because of variants. So your natural immunity won't be able to defend you much longer. That's what we know. And the vaccine for now, at least from where we're using Israel and the UK, has given immunity for at least 3-4 weeks. As the months don't pass, we won't be able to know how long. But I just want to say something positive in the light of reinfections, and if we do have immunity, there's always a chance, and we're working on trials, to give the booster doses for all those variants that the vaccine we have received might not be effective. So we shouldn't think that, why should I take this vaccine? Because there'll be a variant and it's not effective. Absolutely, that is not true. Booster doses will be possible. We cannot say how long the vaccine will give us immunity until we see the effects right now. So it's work in progress. So it's very difficult for us to evaluate that. Natural immunity was seen didn't last as long as we would have wanted to. Past 3 months, 4 months, we realized that patients were prone. And yet again, you can be prone to, as what has happened in Europe, you can be prone to a new variant, which is more aggressive. So you must get the vaccine because of the chance that your natural immunity, and can be seen in Europe, is not going to defend you, is not going to protect you for a very long time.
All right.
And just a quick, Jeff, if I could just quickly mention 2 things that are important, because people have asked, when you get your first dose of the vaccine, remember you must keep all the protocols in place, at least for 14 days, from 12 to 14 days, you have 0 immunity. So getting the vaccine today doesn't mean the next day I can, start meeting people. It's very important to understand that even after 14 days, you're still not very protected, but you've started building up. So many people might take the vaccine and then feel that they're protected, but you really must wait until maybe past 35 days, you started having a very strong So you keep waiting. And it has been shown the AstraZeneca will protect you even past those 8 weeks, because even the UK were trying to evaluate a single dose to see so that as many people as possible could get vaccinated. So yes, to answer the question, you should get your vaccine because this gives you better and more robust, let's say, defense mechanism towards hospitalization and death. So let's just keep remembering the problem here is hospitalization and death. So if you do get COVID after your vaccination, it'll be very mild, and we can probably reduce it to the importance of a flu.
All right, got that. Okay, Dr. Kim,
can I make a small comment?
Yes, go ahead, Dr. Kim.
And those are very valid points. But just to reiterate, the vaccine protects you. It doesn't protect the next person. You're still infectious even though you've had the vaccine. So that's the one thing. The concept of herd immunity is also a discussion that can be held on a different day, because ultimately the more people who are vaccinated, the less likelihood that they can actually contract COVID.
Absolutely. Yeah, it makes sense. It makes sense. How about this one, Dr. Kim? On you still. Since there's a new strain of COVID-19 and the version of the spike protein used by the vaccine was designed to match that of the old virus, does that mean the vaccine will not be effective in, say, a year's time? Valid question.
I actually don't believe so. My colleague who spoke just before me talked about variants, and we are definitely going to come up with different variants, and we need to be geared towards understanding and accepting that we'll have to re-engineer various vaccines. I think one of the issues around vaccines and how vaccines are developed is, do you either use a live version of the antigen, or do you use an engineered version of the antigen to create the vaccine? And I think that's a very important differentiation that, well, not in this particular forum, that needs to be understood, because the effectiveness rather of the vaccines could be closely associated with how the vaccine is actually engineered and developed. So, yeah, maybe I'd actually like to hear what her views are.
Dr. Sally, you want to comment real quick, or shall I go over to Dr. Mercy? Yeah, Dr. Mercy, go on.
So, I mean, the science there is interesting. I did come across a paper that was saying, at the end of the day, despite the mutations that are happening in the spike protein, that these vaccines are still effective, particularly when it comes to preventing progression to severe disease and death. And when we sort of think about 1 year from now, what the situation will be like, I can tell you again, the evidence is still not there. Lots and lots of trials out there that are looking at the different mutations that are ongoing. I'm happy, to at least announce that in Kenya we are doing some robust genomic sequencing and surveillance, and trying to look at different databases across the world in terms of, are these mutations significant enough, particularly when it comes to the vaccine, and of course when it comes to disease transmission. And so really after, babbling on technically, the answer is that we really do not know that right now. And in terms of the current mutations, particularly the key variants that are popular, so far the vaccines at least are preventing progression to severe disease.
Let me stay on you for a question that was asked earlier on, Dr. Mercy. You got the vaccine, and it had a certain effect on you. Some people have had fever, headaches, nausea, 2-3 days, and then of course, come back to normal. And other people, absolutely no effect. Why is that?
So that's a good question. So today I happened to have a small immunology class with my old professors, and we discussed that same sort of element. And some of them sort of spoke of the notion of perhaps I could have been possibly having, some form of active disease, and the introduction of this vaccine and agent in me sort of flared up an immunological reaction. And Jeff, I think I shared this with you because we were in communication about 2 weeks ago. I sort of did have, on a scale of 0 to 10, I'd call it a good 6 out of 10 because, for a day or two, I wasn't able to do much. But at the end of the day, when we look at our database and we are tracking all adverse effects following immunization, we currently have about 236 of them registered. And all of them sort of range, in terms of fevers, pain at injection sites, and sort of what I experienced, just headaches and lethargy and some dizziness. We've marked out just 22 of those events that sort of seem to be on a higher scale. And I'm glad to note that after investigating those events, all of those people are back at work with no ill effects. So at the end of the day, we still do consider this vaccine to be safe. And we encourage people, a headache and pain in the arm should not deter you from coming forward to receive the vaccine.
All right, I get you. Dr. Sally, here's one for you real quick. Breastfeeding mothers, are they advised to take the vaccine?
Well, for now, everything that's dealing with, when we're dealing with maternity care, because they were not included in the trial, we cannot give that green light yet. So pregnant women, children, so because they weren't included in the trial, we haven't moved to them yet. The trials will come out now, and once they're out, then we'll be able to move forward.
Yeah, okay, good answer. Real quick, Dr. Mercy, back to you. What other vaccines should Kenyans expect on the market? We've got Astra, we've got Sputnik V. What else should we expect?
Right. So right now, the approach that we're using is that, the more vaccines you have available, the better. The better in terms of economies of scale in trying to meet at least 60% of our population vaccinated. And also, increasingly, the evidence does show that, you have better probabilities when you have more vaccines available, just by the very nature of having all these vaccines undergoing trials in different jurisdictions, race, color, epidemiological sort of situations across the world. Right now, we have Sputnik V available, we have AstraZeneca available, we have applications, pending and, pre-submission meetings going on when it comes to J&J. We're also discussing, with Pfizer, Moderna, as well as biotech from India. So there's a whole large number of candidates who are lining up. And so, within the next few days, as we continue the submission process, the evaluation process, I'm sure a time will come where we'll probably have 3 or 4 candidates in the country available.
So what you're saying, the more the merrier, bottom line?
The more the merrier. As far as we see it as government, the more the merrier.
All right, you guys have been extremely informative today and lots of questions, and we thank you so much for your time. I want to conclude, get some final thoughts moving forward. Dr. Sally, let's start with you all the way in Ibiza in Spain. Moving forward, give us your thoughts.
Is my microphone okay? So I think the most important thing is for us to understand the only way we can get out of this pandemic is through vaccination. Because of mutants, because of we cannot continue with lockdowns. My final thoughts are, the message is, let us try to get all vaccinated. If we let the virus continue mutating and continue spreading among the population, we will not be able to get a hold on it, and it might transform itself into something that we won't be able to deal with. So the message is, continue keeping the protocols and protecting ourselves, but we all need to take the vaccine as soon as possible. And the fears on which vaccine to take, and that everything was done so quickly. Let's remember that the first vaccine, which was invented for smallpox, and then smallpox came to be eradicated, was invented more than 200 years ago. And the person who invented it only had a child, and in 18 months, he moved forward, made a publication, and years later, smallpox was eradicated. So I think it's very important to think that in this epoch and this time, so much collaboration has been there The studies have been done by very robust institutions, and we need to trust our national institutes and the world institutes, because no scientist would want harm knowingly for anyone in the population. So I just would like to keep up in the campaign of we all need to get vaccinated.
Absolutely. Thanks, Dr. Sally. Appreciate that. Dr. Kim, before you give me your summary or your closing thoughts, real quick, I've had several of these questions posed to me, and probably a lot of people have asked you this. If one gets the vaccination, whether it's J&J or whichever one you have down south, how soon before one can have a drink?
The next day. I think what we should understand is that the question has been posed: how effective and how soon will you see the effects of the vaccine, whichever it is? Some of them are single-dose vaccines like J&J. Others are double-dose like Oxford AZ and Pfizer and so on. So the question begs, when does a vaccine actually take, convert or seroconvert? So I don't know. Hey, the next day.
Very good. And finally, lockdown has worked, has not worked where you are?
It has, Jeff. I mean, what we've seen is one of the components of level 4 lockdown was to shut down the borders and to close liquor stores. And we actually saw a dramatic drop in the number of new COVID cases. But obviously there were consequences to that. Like closing down liquor stores, restaurants, and having a curfew from I think it was 9 o'clock, well, 6 o'clock to 9 o'clock or something like that. But we saw the benefits of that. We saw the numbers dropping. But as I said to you earlier on, government then had to make a decision or had to balance between the economy and, because you know yourself that, most of our economies in the African continent are SMME economies. How do you continue to support those economies and ensuring that, we at least manage to contain the numbers of COVID cases. So has lockdown worked? Yes, it has. I don't like the term lockdown, but it actually has worked.
Yeah. Okay, Dr. Kim, thanks so much for that. Dr. Mercy Mwangangi, I'm going to...
Should I summarize?
Oh, okay.
my closing point.
Yes.
Closing point.
Yes.
I think what I would like to hear politicians and decision makers articulate. We all talk about when this COVID ends. What does that mean? We talk about post-COVID. I think we need to get to a point where we agree and be able to define what post-COVID is. Is it an economic definition? Is it a health definition? We talk about rolling out vaccines. I agree very much with my colleague in Ibiza that we should vaccinate as best as possible, but it's a very comprehensive and complex program that needs to be planned carefully and managed properly, including education, including understanding who. I gave the example of Kibera and Soweto or Alexander Township. How do you actually roll out a vaccination program that area? Do you prioritize the people with comorbidities, the elderly, and then you go for the youth, or you just vaccinate anybody but everybody who you come across? So it's actually quite a complex program, and I do support the fact that we do need to have a very comprehensive and very radical vaccination rollout program.
Yeah, totally agree. Thanks, Dr. Kim, for your summary. Dr. Mercy Mwangangi, I'm going to give you the last word with the question, lockdown. We are barely a week into this new one, And I tell you, everyone's at each other's throat. Everyone's about to literally, get at each other. But yet, what do you tell them? At this point in time, what do you tell them? They're all listening.
Right. So, Jeff, yes, everyone is, at each other's throats. I can tell you I've been a recipient of a lot of energy in terms of people's frustrations when it comes to the lockdown. And like I said earlier, this is a decision that required to be made. It was a necessary decision. I've seen a lot of people questioning, the evidence that informed this decision. I've seen a lot of people, talking about considerations for the economy compared to health considerations. And I can tell you, by the time the president was pronouncing himself on the lockdown and the containment measures, the situation was dire. I can tell you people were having waiting lines for ICU beds and still do have waiting lines right now for ICU beds. If you knock at the door of close to some of the 20 popular, hospitals, both public and private, within the 5 counties, I'm sure you'll be put on a waiting list. So that is the real situation. And it's easy for people who perhaps may feel distant from COVID or who may not have a mother or an auntie or an uncle who is struggling with COVID to sort of say, hey, government has made the wrong decision. But I can tell you at the end of the day, we always act in the best interest of the public. We do have perhaps a wider lens of view of what is happening, particularly in the healthcare facilities. And so really this is a needed measure. My colleagues from Spain, South Africa have shared their experiences. They've had more severe approaches when it comes to the lockdown term. And so what we are asking Kenyans to do is to really work with us, and particularly during this Easter season, and as we move into, the Easter celebrations, it was really important to really put in place measures. Otherwise, our hospitals would have been bursting at the seams. And at the end of the day, even as we work to ensure that this infrastructure is expanded, is available, I'm sure you've seen concerns about oxygen. We're working on that to secure and avail oxygen for everyone who requires it, particularly in the public spaces. The 3 measures are still the ones that are very vital. And now we have vaccines on top of those. So let's wash our hands, let's social distance, let's mask, and let's, come forward when it's our turn to receive the vaccine.
Absolutely. Dr. Mercy Mwangangi, Dr.
Yes.
Kim Shongwe, Dr. Sally Kuria, thank you. Thank
Can
you.
I help in quickly?
Dr. Sally,
I just need to say one quick thing.
Okay.
I just need to say one quick thing. I need to make a quick rectification because it's something that pregnancy and children do not get the vaccination, but we have vaccinated our breastfeeding mothers. We have vaccinated them. I just want to correct that because it came through incorrectly. The trials have not been done on children and pregnant women, but we have vaccinated most of the vaccines that we had, especially remaining in the centers. We gave them out into our ward. So we have vaccinated. I just want to correct that because it's very important so that our breastfeeding mothers do get vaccinated.
Thank you so much for clarifying.
I prepared that on my slides for children and pregnant women.
Yes.
But breastfeeding all the way, it's possible, and please go ahead and do it. Just wanted to make that rectification. I apologize.
Very good. No, don't apologize at all. These are amazing insights, and thank you for the clarification. And thank you, Dr. Sally, Dr. Kim, Dr. Mercy, for all your insights tonight. You guys are incredible. You really made my work easy today. A lot of people's questions have been answered. We appreciate it. Stay safe. Happy Easter all. Thank you so much. Wow, what a show. Thank you so much for your questions, your comments. Please keep them coming at Koinange Jeff at Citizen TV Kenya. The hashtag is always JKLive. Remember, JKLive is powered by Johnny Walker. Johnny Walker exhibiting its eminence in electrifying quality and celebrating 200 years of blended Scotch excellence. Well, where do we go from here? You've heard the doctors. You've got to keep safe. You've got to stay masked. You've got to sanitize, wash your hands, and you got to social distance. That's how we're going to defeat this thing. It's not rocket science. It's basics. Happy Easter. Stay safe. We'll see you next week. Good night. Good luck. God bless you all.